here today, and then you'll hear from some other folks as we get going. So I'm the parent, along with my wife, of 2 kids, ages 5 and 6, and so they're now eligible to get the vaccine, and we are incredibly excited about that. Obviously, we're still, trying to figure out where and when to get them vaccinated. There are increasing number of options, and it's, they've been at home for a long time, they've worn masks for a long time, and this is just an amazing point to be at in this whole process. So I'm really thankful for, science and everybody who's worked to get us to this point. One thing that we wanted to make sure is that everybody has access to this, whether you can go to a pharmacy, private pediatrician, or whether you can go to a school. And that's really what we're here talking about today is the school option. Before I hand it over to a parent who you're going to hear from, Rosa Trevino, who's a parent of a student here at Del Valle ISD, I just wanted to share a little bit more information about why we're taking this school-based approach. The beginning of the vaccine rollout, we learned that the best way to get vaccines to people is to make it really easy. Try to remove as many barriers as possible, make them be able to go to places where they don't have to register, and then if they can't go to a place, try to come to them. And that's what we, along with Constable Morales and everybody else here, have been working on. Parents already have to send their 5 to 11-year-old kids to school, so why not use the school buildings, a place where people, and especially our children, feel safe and comfortable to get them vaccinated. Our hope is that by doing the school-based approach, parents won't have to go out of their way or deal with the stress of fighting for an online appointment or trying to figure out which private provider might do this and where they are located. And our children would get these life-saving vaccines just as quickly as possible in the schools where they go. This school-based approach allows parents to receive the care that they need with familiar faces in familiar spaces, where they can ask people they know and they trust any questions that they have about the vaccine. And I know parents all across the county and really everywhere and know that parenting in the time of COVID is really hard, and it's been really hard. And we hope that this initiative will make it a little bit easier to get safe and trusted information from people that you trust and access to vaccines. So I'm going to turn it over to Rosa Lee Trevino, a parent of a student here, 2 students here at Del Valle ISD. Rosa.
Hi, good afternoon. My name is Rosalie Trevino. I work for Del Valle ISD, but first and foremost, I'm a mom. I have a 5-year-old and a 14-year-old, and although I'm vaccinated just recently, I had COVID. And the thing that was running through my mind the whole time is my 5-year-old going to get sick? He's also asthmatic. So it was a fear, a real fear that I had that something would happen to him. So I'm really appreciative of our school district to provide this convenience for our parents, to make sure that our kids are safe in school and that I feel safe every day dropping them off. And aunque me llamo Rosalie Trevino, tengo 2 hijos en el distrito de Del Valle, uno en kinder, uno que va en 9, y aunque estoy vacunada, me enfermé del COVID, y durante ese tiempo estuve muy asustada que mi hijo de 5 años, que es asmático, iba a agarrar el COVID. Y lo bueno es que no, pero lo bueno es que el distrito, estoy muy agradecida que el distrito está ofreciendo la vacuna a los niños de 5 a 11 años en las escuelas, que es fácil para los padres. Thank you. Gracias. And now I'm going to turn it over to Commissioner Gomez.
Thank you so much for being here with us today to celebrate this new start for vaccines for our children. We have long had a collaborative with other agencies in the county, the school, the Ascension, and other providers. And now our partnership with the school system is going to be extremely important to us as we try to curb the COVID situation that has really taken over a lot of our families. And we don't want that to continue. So I'm looking forward to continuing this collaboration that we have started in Travis County that has been very successful. And we've gone to people where they are instead of having people come to us. And so we think that we have removed a lot of barriers in that manner. And I believe that we will have a success here as well as we did in other places. So thank you so much for helping us spread the word. And now I'm going to call on Christopher Weddle.
Good afternoon. I'm Christopher Weddle, Executive Director of Communications for Del Valle ISD. First, on behalf of our superintendent, Dr. Annette Telly, I want to thank all the partners here, especially the county and UT School of Nursing, for their continued partnership in bringing this opportunity to our students and the community of Del Valle. Starting next week, all of our campuses, elementary and middle school, including Collins Elementary that we're at, will begin offering on-campus vaccination clinics for our 5 to 11-year-old students. Our goal with offering on-campus vaccination clinic is to provide an easy access for parents to be able to have their child vaccinated in a place that they're comfortable coming every day. So far, we've heard overwhelmingly positive feedback about our plan to host these on campus. And in just about the 3 days since we sent home the consent forms, we've had over 300 students sign up for these vaccines. If parents still want to sign up, they can right up to the date of their vaccine clinic at their campus. There is an additional communication going home tonight that details every single campus's date over the next week and a half. And again, those parents can still complete and return the consent form. If they didn't receive it at home or if they didn't get it in the email, they can come to their campus and have a printed consent form that are available in all of our school offices. And I really think that the return of the consent forms just speaks to the desire in our community to have these vaccinations on our campuses. So, you know, again, I just want to thank specifically Judge Brown, again, this UT School of Nursing that we've been partnering with recently to make this happen. Next, I'd like to introduce Amarani Mayamora, who is a public health nurse at UT School of Nursing.
Hello, my name is Amarani Mayamora. Most people call me Nani. It's a lot easier, but I'm here representing the UT School of Nursing. I just want to say thank you to all of our partners for allowing us to come into the schools and provide these vaccines to the children. We have a long-standing relationship with Del Valle ISD with our UT Children's Wellness Center, and we've provided numerous of immunizations to the Del Valle kids. Now that we have in our possession the Pfizer pediatric vaccine, we want to be able to provide that to the children in Del Valle ISD and surrounding communities. So we're really thankful for the opportunity, and we're trying to make it as easy as possible and as calming as possible for the parents and for the child. We're looking at resources to, you know, make the experience less traumatic in the school. So, you know, we have child life specialists that we're going to bring in. We have other resources such as little things like a spray and, you know, a numbing agent to help with the pain. So, muchas gracias por dejarme venir a platicar con ustedes. Me llamo Amarani Mayamora y soy una enfermera de salud pública con la Escuela de Enfermería de UT Austin. Nosotros ya tenemos una relación larga con Del Valle ISD porque tenemos una clínica que se llama UT Children's Wellness Center, donde nosotros ofrecemos vacunas para los niños, y ahora vamos a ofrecer la vacuna de Pfizer para los niños. Y estamos buscando maneras para hacer la situación menos traumática en la escuela si el papá no puede venir. So, algunos recursos que vamos a traer van a ser especialistas de niños que ayudan a calmar el niño mientras le damos la vacuna, y unas medicinas locales que podemos poner en la piel para ayudar con el dolor. So, le doy muchas gracias aquí a la gente que nos está ayudando a soportar esta oportunidad a los niños. Gracias. I'm sorry. I'm also going to introduce Commissioner Jeff Trevillon.
Yeah, I think he's still on his way, so we're going to skip ahead to Dr. Iyer, the Chief Medical Officer of Dell Children's Medical Center. Thank you, Dr. Iyer.
Thank you all for having us here today. I am Dr. Mina Iyer. I'm the Chief Medical Officer at Dell Children's Medical Center. At Dell Children's, we have treated 189 children so far for COVID-19 since the pandemic began 20 months ago. Although fewer children have been infected with COVID-19 compared to adults, they can be infected, get sick, and spread to others. Pediatric and family physician leaders across Ascension support the CDC and prevention and the AAP recommendation of a COVID-19 vaccine for children ages 5 and older. Making medical decisions for your children can be very difficult, and here are some important facts about the vaccine we think all parents should know. The Pfizer-BioNTech COVID-19 mRNA vaccine, it's a 2-dose series, 3 weeks apart, and it's the only COVID vaccine currently approved for use for children ages 5 to 11 at present. Thousands of children were involved in the clinical trials, and the data shows the vaccine to be remarkably safe and effective in preventing symptomatic COVID-19 hospitalizations and death. The vaccine is currently under emergency use authorization. However, we anticipate it will be fully approved the next several months as additional data from clinical trials come in. There were no shortcuts in the development and approval of the vaccine for children. The technology for the mRNA vaccine and the study of coronavirus has been ongoing for decades prior to the pandemic. The clinical trials were rigorous and proved the vaccine to be both safe and effective. Help protect your whole family and slow the spread of COVID in our community by getting yourself and your children age 5 and above and older vaccinated against COVID-19. I really appreciate the efforts that's ongoing to get vaccination for our kids and our children, and I thank for the effort, for the opportunity to be here and talk to you all about the vaccine. Thank you. And I would like to introduce Elana Bejarano, Austin ISD Director of Health Services.
Thank you. Good afternoon, everyone. I'd like to say thank you for inviting us here. AISD has worked with many of the partners you see behind me to make our children's health a priority. We're going to continue to do that throughout Austin ISD. We're using interesting strategies to make sure that the vaccine distribution is equitable. We're going to use several of our hubs that are already existing throughout the Austin ISD community. We'll be adding some weekend sites. We'll be working with some food distribution people. We're going to put them out as far and as broad as we can to make sure everybody has access. Many of our campuses will be hosting events. As soon as our providers get those vaccines, we'll be introducing the schedule, and it'll be on our website and various community outreach programs. So we're very, very happy that this has been approved and to work with many of the generous people you see behind me. And with that, I'm going to introduce one of our partners, Constable Morales.
Good afternoon. I'm Constable George Morales, Precinct 4, Travis County. I am one of 2 operations chiefs in the Mobile Vaccine Collaborative. Our goal is to offer barrier-free vaccines to the underserved community. We have done that. With the help of our Travis County Commissioner's Court and our county judge, we took our vaccines to people who did not have access to transportation, Wi-Fi, or any form of communication to actually get a vaccine. Today I stand before you excited that we're pushing forward and making our children here a priority. So thank you for everyone that's involved, our community partners, and I'll introduce Dianna Rodriguez with Manor ISD.
Good afternoon, everybody. My name is Dianna Rodriguez, and I'm with Manor ISD. I'm the Interim Director of Health and Wellness. Manor currently has plans underway for a vaccine rollout for our scholars ages 5 to 11. We're looking forward to providing our scholars and parents with an opportunity to return to a sense of normalcy. We'll be providing multiple opportunities to get COVID-19 vaccines with the support and help of our local agencies and partners. Manor ISD realizes that our priorities are to bridge the gap of our underserved scholars and communities, and our ultimate goal is to ensure equitable access to high-quality care and availability of vaccines for all scholars. We highly encourage all our scholars and their families to stay informed and connected with Manor ISD for more information and resources regarding COVID-19 vaccines. At this time, I'll turn it over to Dr. Thomas Hockaday.
Good afternoon, everyone. I'm Dr. Thomas Hockaday with the Central Texas Allied Health Institute. For the last year and a half, we have been operating a COVID testing and vaccine clinic in East Austin for the underserved community of the Eastern Crescent with the help of our students and faculty who look like the folks in the community, who live in the community, and we're very proud of the work that we have done. We are excited to be the newest member of the County Mobile Collaborative, and we look forward to working with Manor ISD to help our children get vaccinated in the region. We'll be offering 10 sites and after school hours, to be more convenient for our students and our parents to be able to have equitable access to the vaccine. As a mother myself, I know that this is very important for our school children, and it will help give them a barrier protection while they're attending school. And at this time, I'm going to introduce Council Member Vanessa Fuentes.
Thank you so much. Hi everyone, good afternoon. My name is Vanessa Fuentes, Austin City Councilwoman for District 2. We're so excited for the approval for vaccines for kids 5 and up. It was long-awaited news for us, and I know that parents could not be more excited to have the vaccines ready. And we're taking a big leap in protecting our community and moving away from this pandemic. I first want to give a huge thank you to County Judge Andy Brown for his strong leadership during this time and all that he and his team have done to help serve our community, especially during this critical time of need. I also want to thank the Travis County Collaborative for quickly stepping up to meet this need. We know the kids who often have been left behind are now a top priority to get access to safe and effective vaccines. Our communities of color have been devastated from this pandemic, and the county's action signals that our Black and brown families and kids like those in my district right here at Newton Collins Elementary, that they deserve to be safe just as every other kid in Travis County and in Austin. And I'm also happy to share from the city, Austin Public Health is providing vaccine to reach our littlest Austinites. Starting this week, APH will be offering kid-sized doses for shots for tots and big tots at both the Far South Clinic and St. John's Clinic. Appointments are required for those shots for tots clinics. But if you don't have time to schedule an appointment, join us this Saturday from 10 a.m. to 2 p.m. at a community resource workshop that my office is hosting in the district at the Dove Springs Recreation Center. APH will be providing a walk-up clinic that will be offering vaccines for kids. And so that's really important that we have this opportunity in just a few days from APH side of thing. And then from there, Austin Public Health will be adding the Delco Center and the Old Sims Elementary as sites starting next week, and then eventually expanding the following week to include clinics at schools with a focus on areas where vaccine access is limited. Again, thank you so much for having me. It's thrilled to be part of this effort and excited to be one step closer to get to the other side of this pandemic. So I'm not sure. Okay.
Geronimo's next. Thank you.
Thank you.
Councilmember. All right, so up next, Geronimo Rodriguez, the AISD Board President. And is that the role you're?
Yes.
Okay, all right.
Thank you, Geronimo Rodriguez, President of the Austin Independent School District Board of Trustees. You know, collaboration, teamwork, and vaccine is the way we're going to get out of this pandemic. And over 10 months ago, the Travis County Collaboration got together and has been providing over 200,000 vaccines to our adults, including those teachers and staff at Austin Independent School District. And today we know that children are the most vulnerable to the pandemic, to the coronavirus. And we want to make sure, and I appreciate all of the collaboration from our level 1 pediatric medical center, adult children's here in our community, to our community groups such as the Health Institute. And most importantly, I just want to thank Judge Brown and George Morales and others for their leadership around making sure that we are protecting the health and safety of our community so we can get back to a normal life. And with that, I will turn it over back to the judge.
Thanks, man. All right, so just a couple details. So I believe we have about 5,000 vaccines that have arrived already. And so the vaccines, they come with a special needle, smaller needle. They come with a vial that's a different color just for pediatric kids, or that's redundant. But so we have the vaccines this time. We have the locations. We have partners in Del Valle, Manor, AISD, Austin Public Health. So a little bit of bad news is I was talking to Dr. Walks this morning, and she was mentioning that the community spread levels are still at levels too high to be comfortable. And we're seeing other states like Colorado where they have emergency rooms that are overrun because of COVID again. And so I would just urge every parent, including myself, to get out there and get your kid vaccinated as quickly as possible so that we avoid any other surges. And then, so open it up to questions now, and I can talk in Spanish if y'all would like, on any of the on the Spanish stations.
I'll open up right here.
Okay.
Anybody have right over here?
How soon will the schedules come out for each school district?
It's a good, let's start with Del Valle. You want to just talk about the availability? So it'll be, what, every elementary school?
Yes, so we'll be starting with all of our elementary and middle schools starting Monday. I could read off all 12 of them, but we are starting next on Monday, and it'll go for about a week and a half for the first dose clinics.
And do they need to make appointments?
So they need to complete, parents need to complete a consent form that was sent home with all students on paper, also sent home digitally, available in the office to be able to receive those vaccines, yes.
Oh, yeah,
I can speak really quick. AISD will have them beginning next week. They still will need consent, but then we're going to open up the schedule as our providers get doses, so it'll be a mass effort beginning next week.
Other questions?
Maynard.
So in Manor ISD, we'll be hosting our clinics beginning the 15th of November, and they will be held at 8 of our elementary campuses, 2 of our middle school campuses, and they will begin at approximately 3:30 and run till about 6:30. So about 3-hour clinics. Walk up, families can get their both their children vaccinated on those days.
Councilmember, when does it start?
So they'll have Shots for Tots clinic starting. So they'll have Shots for Tots clinic open up starting Monday, and that'll be at the Far South Clinic and St. John's Clinic, and then there's one this Saturday at the Dove Springs Rec Center from 10 a.m. to 2 p.m.
Thank you.
Other questions?
Yep.
And you said you have 5,000 vaccines.
Yeah.
Do you mean the Travis County Vaccine Collaborative, or is that a combination of different?
No, that's the collaborative, basically. It's through Ascension Seton is the entity that officially receives them from DSHS, DSHS, and the allotment so far is 5,000 something that y'all have in hand. And if you want to, Geronimo.
Sorry. The 5,000. So publicly, you have seen a list of pediatric offices and hospitals that have received the vaccine here in this community, and 5,000 of it was sent to Seton Medical Center Austin, but those are really for the collaborative that's working with Del Children's Medical Center and Seton Medical Center Austin. So we have 5,000, and we expect to order more. I don't know, Dr. Iyer, if you have any other comments.
So the doses that have come will start getting distributed through Del Children's Medical Center. So Del Children's is planning on setting up some clinics that will be both for the community, patients who are in the emergency room and admitted, and for a specialty clinic. So in the process of planning, as soon as we have more information available, we'll have that on our websites.
And for Del Valle ISD, the UT School of Nursing has their own allotment as well. So I think the thought there is this isn't something that we're not going to run out of. The Biden administration has assured us that there's going to be plenty of supply here. So really the challenge is just for parents to find a place of the many places available to get it as soon as possible. Yeah.
Anything else? Thank you all. I appreciate you all coming out. Let me know if you all have any follow-up.
Yeah. Thank you all very much. And thank you all very much. Yeah. Hey.
Oh, gotta love that, dude. Oh, I thought it was mine. I'm sorry, dude.